Dr. Vanita Zahn.
When you don't have enough money, you find things to cut back on. And lately, for an increasing number of people, that is medical care. Dr. Cliff Gevirtz is an anesthesiologist, and he joins me to discuss what he and his colleagues are seeing. And this is, I guess, a hidden impact of the pandemic, Dr. Gevirtz?
Unfortunately, it's a big impact, yes.
Now, you work downstate. You're involved with a group, a sort of a virtual doctor's lounge. So you're hearing from many physicians. And what's the takeaway of what you're all discussing?
The virtual lounge is called CERMO, and it is an online community of docs, and they run polls about the impact of COVID on the economics of our patients, people who don't show up, people who are not able to fill their prescriptions. And what their polls are showing are huge numbers of people who have lost their insurance, who literally have run out of money. We have people who are diabetics, who are hypertensives, and they literally have to decide, am I going to feed myself and my kids today, or am I going to take my medicine? And it's a terrible choice that we're being forced to make, or they're being forced to make every day.
And we know that if you don't take care of these chronic conditions, number one, they will worsen. Number two, they can be deadly. But
Yes.
then down the road, obviously, it becomes more expensive. So what's the takeaway? What are physicians doing? What can people do?
Well, we're switching people to as many generics as we possibly can, keeping them on formulary if they're on Medicaid. The social workers in the hospital are getting people enrolled in Medicaid and Obamacare plans as best as they can. But when you have people who are homeless, people who are undomiciled in general, it's extraordinarily difficult to get them aid.
There are some programs that people can sign up for. There are, the RX cards. Are we seeing more usage of those, and are they helping?
From the poll, I think that people that I know of, that they are using those sign-up RX cards. I mean, personally, within the hospital, we're not using that system, so that's hearsay.
What can we do? If someone is listening to this, whether they're affected or they know somebody is, how do you start? Okay, Medicaid is one place, but who do you talk to first? How do you have the conversation with your doctor? It's embarrassing to say, I can't pay you.
I think the first thing you have to ask for is their help. A lot of docs are willing to forego a payment or two. They're willing to work out some payment plan with the patient. I'll date myself now. In the good old days, if you brought the doctor a chicken, okay, that was payment enough. The issue there is that there are programs out there that they can, the physician can refer the patient to social workers. The physician can bring them, and we have in this hospital, St. Barnabas, we have a lot of outreach programs. So there are programs out there to help them. They just need to get pushed a little bit to fill out this form and fill out that form. But the most important thing is not to forego care, not to be so embarrassed that you're going to lose your leg to diabetes, not to have a heart attack because you couldn't take your blood pressure pills. There is help there. Reach out and do something about it to help yourself.
And that's such an important message for people to hear, because it is so difficult to reach out and you think, well, just a little. I'll just cut back a little. I won't not take the drug. I'll cut back a little. How big a problem for one's health is cutting back a little?
Unfortunately, with diabetes, it's a terrible disease. And if you cut back just a little, you will still have the pathology. The problem will still develop. You have to take an adequate dose of your medication in order to really keep that disease under control. Halfway measures are not going to do it.
I think we've probably covered this well.
Okay.
Step up. No, and the point being, step up. There is help out there, and your docs. And I always say to people, if your doc's not going to work with you or listen to you, find another doctor. Yeah.
There are plenty of community physicians who have not succumbed to the search for money, but rather want to really genuinely help people. You can find them. They're out there.
Yeah, and clearly, with your organization, with CERMO, you're all having this conversation, and I can hear it's hurting your heart, so that you want to make sure that folks do get the care they so critically need in this time. Dr. Cliff Gevirtz, an anesthesiologist down at St. Barnabas, downstate. But you know what? This is not a problem of borders. This is a community that we are all serving. Thanks so very much. Really great advice. Thank you.
Thank you for having me.
And thanks for checking out this edition of Health Beat. Till next time, stay well.